There is a stigma around STIs. Even with perfect hygiene, people are still getting UTIs. Especially Black women have been subjected. They've been used, they've been studied, they've been cut open and experimented on without consent. Period pain is normal, but period pain that interferes with your daily life is not. What if the reason you haven't gotten answers isn't because your body is broken, but because the system was never built to listen to you? Welcome to G Chats. Hi everyone, welcome back to G Chats here in the G Spot with your host, me, Gianna Jara. I'm so excited for today's episode because we are talking about fibroids and what every single woman should know about fibroids. So this is yet another educational video. I think that fibroids is something that affects millions of women, yet somehow it still isn't talked about nearly enough. And that is why I really wanted to make an awareness video about it. And I believe that this video will be going out, if I remember the podcast schedule correctly, it'll be during Uterine Fibroid Awareness Week or Fibroid Awareness Week. And that is why I wanted to make this video largely, but it is something that affects millions of women. A lot of people aren't told about fibroids until they have them. So if you've ever been told that you have a fibroid, you know someone who has, or you've been struggling with heavy periods, pelvic pressure, fertility concerns, or unexplained pain, then this episode is for you. Because as a biomedical engineer who studies female reproductive health, one of the things that frustrates me the most is how many women do not learn about what fibroids are until they actually have them or already have them. And even then, when they do, they are still not given a full explanation of what fibroids are. In fact, they are just told, oh, they're benign, they're non-cancerous, don't worry. And to me, that just doesn't make sense because benign, yes, means it's not cancerous, but just because they're benign doesn't mean that they're harmless. So a fibroid can completely change someone's quality of life. It can change their fertility journey and their daily functioning. So in this episode, I want to break down what fibroids actually are, why they happen, who they affect, and why one tiny fibroid can sometimes cause far more problems than one that is 10 times larger. So first, let's run through what exactly are fibroids. So fibroids are called uterine myomas, and essentially they are, as I mentioned, benign tumors that arise from the smooth muscle cells of the uterus. Now, before you let the word tumor scare you, I want to emphasize that tumor simply means that it's an abnormal growth of tissue. The overwhelming majority of fibroids are non-cancerous, and only an extremely small percentage of these tumors represent a cancer that we call leiomyosarcoma, and this is something that develops independently rather than from the fibroid itself. So that's the first thing that you need to know, that fibroids, generally speaking, tend to be non-cancerous. And if they do become cancerous, it's usually like independent from the fibroid itself. It develops on its own. So I want you to think of fibroids as areas where one muscle cell that's inside of your uterus will begin multiplying over and over and over again. And eventually it starts to form a firm ball that's made of muscle tissue and connective tissue. And some people will develop one fibroid, and then other people will develop dozens of fibroids. Some are the size of a pea, and then others can become as large as a grapefruit, or in rare cases, even larger. And the thing that's like super fascinating when we talk about fibroids is that fibroids aren't just like random lumps, which I think a lot of people think that they are. Fibroids are actually biologically active tissue. So what does that mean? Well, it means that they have their own blood supply, they produce growth factors, they respond to hormones, and they're constantly communicating with the environment around them. So it's actually a little like freaky in a way how biologically active that they are. I think a lot of people think like, oh, it's just a mass in the uterus, it's just a lump, but they are more interactive than many people realize. One of the biggest misconceptions is that people think the larger the fibroid, the worse it is, right? People think that you have to have these absurdly large fibroids in order to have problems. And that is not actually true. Location matters far more than size. And that is because of how biologically active they are. Think of your uterus, right? I want you guys to think of the uterus and let's try to understand how fibroids work. So a very small fibroid, right, that's growing inside of the uterine cavity, it can cause incredibly heavy bleeding, infertility, or recurrent miscarriages because of how responsive it is and where it's located. So it can cause problems inside of the uterus. Now, on the opposite end of things, a much larger fibroid that is growing on the outside of the uterus may cause, in many people, literally no symptoms at all. I know that that sounds crazy because you're probably like, oh, it's larger, it's on the outside. And I know that people just think of size and automatically think that the larger the fibroid, the worse that the fibroid is. And I'm not trying to say larger fibroids aren't painful. They definitely can have their complications. But when you hear someone say like, my fibroid is 2 centimeters, that number alone doesn't really tell us anything. The location absolutely matters, and where it's located matters just as much as the size, if not even more. Because again, where it is, even if it's on the outside, it can be pushing on the rectum, it can be pushing on the bladder and causing bladder issues and urinary issues. So the location matters a lot aside from just size, right? You can have 2 centimeters worth of a fibroid and still have incredible pain, regardless of if it's inside or outside. It really just depends on its exact location and not generalizing it. But I wanted to make that known because I think a lot of people just think like, oh my God, fibroids are like ginormous. And you hear horror stories of people having fibroids that are the size of a grapefruit. Like my aunt had a fibroid during her pregnancy that was the size of a grapefruit. It was on the outside, but it obviously caused so many complications because she was pregnant. So her uterus was expanding. Everything's like pushing on each other. It was a very uncomfortable experience. And it was actually pushing on the placenta inside of her. It was pushing on like her uterus, and sometimes would give her like Braxton Hicks and give her like fake contractions. So I think that it's important to understand like that location absolutely matters. I mean, she kind of got hit with the double whammy of the location and the timing. It was during pregnancy, but also the fact that it was super big as well. Like it was the size of a grapefruit, really impacted her. Just that alone is something that's important to understand when we're talking about fibroids. Now, I do want to mention that fibroids are generally categorized based on where they grow. So submucosal fibroids grow into the uterine cavity, and these are often the ones that are most strongly associated with heavy menstrual bleeding, fertility problems, and miscarriages because they physically distort the inside of the uterus. Then we have intramural fibroids that grow within the muscular wall of the uterus itself, and these are the most common type, and they can lead to enlarged uteruses, heavy periods, pelvic pain, and pressure depending on their size. And then there's subserosal fibroids that grow outward from the uterus, and instead of causing bleeding, they often cause pressure symptoms because they're pressing on nearby organs. Now that can mean that it can cause frequent urination, as I mentioned, because they're pressing on the bladder. It could be constipation because they're pressing on the bowel, or pelvic fullness and discomfort. So some fibroids will even grow on stalks, essentially. Like literally think of a mushroom, right? And you know how it has like the little strip and then the mushroom head at the top? That is sometimes what some fibroids can look like, hanging off of the uterus. And these are called pedunculated fibroids. And if that stalk twists, what happens is it can become an emergency because the fibroid loses its blood supply because the twist cut off the blood supply. And when you cut off that blood supply so fast and aggressively, it causes sudden severe pain and unexplained pain that makes you rush to the emergency room. Now let's talk about why fibroids grow. My honest answer to that is that we still don't have a complete story. We still don't know fully why, but we do know several important pieces. We know that fibroids are strongly influenced by estrogen and progesterone, and these hormones don't necessarily cause fibroids, but they absolutely help them grow. We know that for a fact. And that is why fibroids often enlarge during the reproductive years when hormone levels are at their highest. Also, we know that during pregnancy, they may grow because of the dramatic hormonal changes and the increased blood flow. And after menopause, we see that many fibroids end up shrinking because estrogen levels decline. And genetics also play a huge role in this. So if your mother or your sister have fibroids, your own risk is significantly higher. Now, researchers are also investigating environmental exposures, chronic inflammation, vitamin D status, and certain growth signaling pathways that appear to influence the fibroid development, but none of these have fully explained why some people will develop fibroids and others don't. Now, for me, Lucky me. I have a lot of people in my family that have fibroids. My mom being one of them, my aunt, my mom's sister being another one. So we got fibroids in my family. So it may be worth me doing an ultrasound relatively soon, because every now and then I think of some of the symptoms that I have occasionally, and I'm like, I feel like this could be a fibroid. I feel like I have a fibroid. I'm like suspicious of it. So I feel like I should get that checked out at some point, do an ultrasound and confirm if I have a fibroid. But I have my suspicions. And with all of that being said, talking about why or like who gets fibroids and how they occur, and talking about the things that I think influence fibroids development and growth, I wanted to mention the disparity that fibroids are often found in Black women at higher rates than in white women. And I feel like I talk about Black women in so many of my podcast episodes, and I know that you guys appreciate it so much, and I'm so glad that you guys do, because I think it's so important to repeatedly discuss the disparities that exist, and fibroids are one of those areas in female reproductive health where the disparity is just so drastic and alarming when it comes to fibroids. And I pulled some statistics that I wanted to read. So I wanted to make sure I included it in here, and I'm just scrolling and trying to find it. Some of the statistics show us that Black women are disproportionately affected, right? And by age 50, more than 80% of Black women will develop fibroids, compared with roughly 70% of white women. And this is from the American Medical Women's Association. And I think it's important to understand that it's not just that fibroids are more common, but Black women tend to develop fibroids at younger ages, develop more numerous fibroids, meaning they have like more than one. Like Black women are having like 5 fibroids at once. They have larger fibroids than white women. They experience more severe symptoms. They undergo surgery more frequently, and they often face longer delays before diagnosis and treatment. And one study actually found that Black women are diagnosed with fibroids about 3 times more often than white women. That is insane. I think naturally one of the biggest questions that researchers continue to ask is, why is that the case? Like, why are Black women being diagnosed with fibroids at about 3 times more than white women? And the honest answer to that, again, is that we don't have one definitive explanation, but it's worth us discussing in this episode and exploring the combination of genetics, biology, environmental exposures, and social determinants of health all interacting with one another. I wanted to take this opportunity to share my educational perspective here, because I think that it's a very important conversation, because when we talk about health disparities in America, in the United States, we cannot ignore that structural racism has played a role in shaping health outcomes across generations. I hate when people act like just because like slavery ended, they think that like racism is gone, and they think that the racism that existed years ago does not play a role in health outcomes today. Like, that is just not true. Racism plays such a big role in health disparities in everyday life, but like especially in this episode, what we're talking about, health disparities towards Black women, 1000%. And that being denied always baffles me, because historically there have been policies like redlining, for example, that determined where families could live. Those neighborhoods often then had fewer green spaces and greater exposure to environmental pollutants, less investment in healthcare infrastructure, fewer grocery stores with access to nutritious foods, and higher levels of chronic stress that's associated with poverty and discrimination. So just think about what we just talked about, right? Let's go back in time. Let's think of redlining, okay? Fewer green spaces. So we're talking greater exposure to environmental pollutants, right? They're not in greenery. They're not in healthy environments. They're put in environments where they have toxic exposure to environmental pollutants, right? So that already can cause effects in the body alone. Then you have these areas not being invested in when it comes to the healthcare infrastructure. So that impacts the accessibility to quality healthcare. That affects then diagnosis and treatment, right? If there's poor access to healthcare, then the outcome is that these people will not be diagnosed and won't be treated. that is a problem. Then you have fewer grocery stores. So again, there's no access or less access to nutritious foods. So we set people up with poorer diets, which of course is going to impact the body. And then you have higher levels then of chronic stress that is associated from the poverty that they're living in and the discrimination that they're facing. And these policies may feel like it's just history, but their effects can persist across generations. And that is something that is so important to talk about, because researchers have spent years studying how chronic stress affects the body. And one of the biological pathways that's often discussed is inflammation. Everybody likes to talk about inflammation. And when someone experiences chronic psychological stress, years over years over years, or even over decades, the body does not simply turn stress off. We can see changes in stress hormone signaling. We can see changes in immune function, inflammatory pathways, sleep, cardiovascular health, and many other systems. So to be clear, I don't want to say, and I'm not definitively saying that chronic stress causes fibroids, because the science simply is not there yet. But researchers are actively investigating whether chronic stress, inflammation, environmental exposures, and other social determinants may contribute to why fibroids are more common and often more severe in Black women. And there's also the added layer of access to healthcare, because if someone has less consistent access to a gynecologist, there's longer wait times, inadequate insurance coverage, or repeatedly has their symptoms minimized because of medical racism, a diagnosis might be delayed. And as I already said, a fibroid that could have been identified years earlier may continue growing until it's causing severe anemia, debilitating pain, fertility complications, or it could require a much more invasive surgery after all of those years. So I think that that's really important to understand. And we also know from decades of research that Black women are more likely to report feeling dismissed or unheard within healthcare settings, and studies have documented the disparities in pain assessment, diagnostic delays, and treatment across many areas of medicine, and not just fibroids. But this is something that we see time and time again against Black women. So when I think about why these disparities exist, I don't think that there's one answer, but I think that it's genetics interacting with environment. And I think it's biology interfering or interacting with lived experience. I think that it's hormones interacting with healthcare access. And it's exactly why I believe that this topic deserves so much more research, because until we understand why these disparities exist, it is so difficult to fully address them. So I wanted to make sure that we highlighted these disparities in this episode. I was like, there's no way we can talk about fibroids without addressing almost like the elephant in the room, which is what it feels like, because fibroids disproportionately affect Black women. And I do want to mention that there is some research that talks about how it's multifactorial, and it does explore some of the reasons that Black women might develop fibroids more frequently. One of them is the vitamin D deficiency, and it's been investigated because darker skin in general synthesizes less vitamin D from sunlight. And this doesn't alone explain the disparity, but it could be a contributing factor. And like I mentioned, we have environmental exposures, chronic stress. I'm just going through my notes, and I want to make sure that I'm not repeating myself, since we already talked about chronic stress. I really wanted to talk about racism that's embedded in our society. But the important takeaway is that the disparity is real, and they've been demonstrated repeatedly, and there's no single explanation that accounts for all of them. But that just means, again, that more research needs to be done. I wanted to talk about how many fibroids cause absolutely no symptoms, and some people never even know that they have them. They're usually discovered accidentally during pregnancy ultrasounds or routine pelvic imaging. And when symptoms occur, they can be incredibly disruptive. They can cause heavy menstrual bleeding, periods that are lasting longer than a week, passing large clots, iron deficiency, pelvic pressure, pain during sex, frequent urination, constipation, lower back pain, difficulty getting pregnant, pregnancy complications, and the list just goes on and on and on, and recurrent miscarriages, particularly if the fibroid distorts the uterine cavity. So again, it all comes back to where fibroids are located, a little bit of their size, and all of that determines the symptoms that you'll have if you have symptoms at all. Now, one thing that I want people to understand is that treatment is highly individualized. So not every fibroid needs treatment. My mom, for example, has fibroids and nothing's been done. They haven't treated them. And it's because they're not impacting her reproductive organs at this time. So not every fibroid needs treatment. If someone has no symptoms, like my mom, many fibroids can simply be monitored over time. But if symptoms are affecting the quality of your life, treatment depends on many factors. Number one is your age. Number two is whether you want children in the future. There's also the number of fibroids, like how many do you have, the size of these fibroids, the location, again, your symptoms. So the options are wide ranges, right? They can be medications that temporarily suppress your hormones and they can reduce bleeding. Then we have minimally invasive procedures. There's things like uterine fibroid embolization. There's also MRI guided focus ultrasounds in selected cases. So this isn't for everybody. There's also a removal for cavity fibroids. There's a laparoscopic, or what we call open myomectomy, to remove the fibroids while preserving the uterus. And there's also the option for hysterectomies for those who no longer desire or just have no desire for future pregnancy or have exhausted all other options. A hysterectomy does exist depending on where the fibroid, again, is located. But there isn't one universally best treatment. The best treatment is the one that aligns with your symptoms, your anatomy, your reproductive goals, and your fibroids itself. Now, I wanted to end this podcast by mentioning that for decades, women have been told that heavy periods are just something that they have to live with, that debilitating cramps are normal, that soaking through pads every hour is just part of being a woman. I want you to know that it isn't, and I'm one to talk, and I will explain in a few seconds. But if you're missing work because of your period, if you're becoming anemic, if you're constantly running to the bathroom, if you're waking up at night because you're bleeding through your clothes, if you feel pressure in your pelvis every single day, those are signs that deserve evaluation because your symptoms are real. You deserve answers. Fibroids are incredibly common, but suffering in silence should never be considered normal, like whatsoever. So the more that we understand them, the earlier they're recognized and the sooner that women can receive treatment that's appropriate for them. So if there's one thing that I really hope that you guys take away from today's episode, it's that you shouldn't judge a fibroid by its size. Judge it by how it's affecting the person who is living with it. Because medicine isn't about just like treating whatever shows up on the skin. It's about treating the person, treating the people. And the reason why I said like your symptoms are real, you should take them serious. I am someone, truth be told, guys, I want to have a very candid chat right at the end here. And I don't know how many people are going to watch this, but truth be told, I've suffered with horrifically painful periods for most of my life. And I grew up in an environment where every single one of my aunts have had debilitating periods, and includes also then my mother, my grandmother. I have had pretty much every single woman in my life have debilitating periods. And when I got my period and my periods were debilitating, you know what I've been told my whole life? I've been told that it is normal. I've been told that that's just what happens. That is what's in our family. We have bad periods. We have heavy periods. I clot every single period. And it's not a clot that's the size of a quarter. I would say in some cases, it would be like, you know how like your palm almost has like a divot, like a dip in your palm? I would say that a clot can sit nicely in the center of my palm. And that is every single period with debilitating cramps that go down to my legs. It's painful, but it's the same thing every single month for the last 15 years of my life. I'm 27. I got my period, 17 years. I got my period when I was 10. The last 17 years of my life, this is just the life I've lived. And I've gotten to a point, I know because I study this and I research this, and I'm a biomedical engineer who studies female reproductive health. I hate sitting on a podcast talking about like, go get checked, go do this, go that, go, like telling you guys to do this when I also need to do that myself. Like, I think that it is time, like I've had enough. I need an ultrasound. Something is there. Like, I have my suspicions. I really do. But something is going on in my reproductive organs. It's crazy because all of my hormones are normal. They really are. I don't think that I have endo. I thought maybe I have adenomyosis. Maybe I have fibroids. I don't know. But the pressure that I get like in my anus, the way that my periods are so painful, the heaviness of my flows, like all of it points to this is not normal. Like I know it's not normal, but it's been my normal for 17 years that I need to like wake the hell up and go get checked. Like I got to go to the doctor, and I know that I got to do that. I am not only advocating for you guys, but I'm advocating for myself. I have a vacation coming up. I'm hoping that when I get back from vacation, I can go to the doctor and explain this and get an ultrasound or something done. I just like, I think I have like a fear of visiting the doctor. As you guys know, like I've had so many UTIs and all that BS that there's like this anxiety and trauma that's associated with doctor's offices and reproductive health. Like I still struggle with that. So you guys aren't alone. Like I feel bad because I'm always telling you guys, do this, do that, do that. Like, right, being the advocate. But I also want to be candid that I still struggle to go to the doctor too. Like you guys aren't alone. I see so many people who talk about how they have anxiety and things like that. Like I just finished my dosages of the HPV Gardasil vaccine 2 years ago. 2 years ago, I took it upon myself to go and get my last dosages, which you should, like everybody should. But like that was my perspective where I was like, yo, I tell everyone, go get your HPV vaccines. And I haven't even got my third dose or my second and third. I can't be saying this and not do it myself. So I did want to plug, like I have some of these symptoms that we talk about when it comes to fibroids. And even preparing for this episode, I was like writing all these notes down. I'm like, damn, do I have a fibroid? That's what I was thinking. I'm like, I feel like I do. I feel like I have fibroids, but I got to get checked. So I need to take that step to go to the doctor, get the ultrasound done, get my body checked and see what's going on because something feels off. I just feel like because it's been my normal for 17 years doesn't mean that it is normal. And it's something that I just want to rule out. In the coming months, I will take myself to the doctor and I will make sure that I update you guys in one of my podcast episodes. So if you are wondering, watch my other future episodes to see if I bring up an update on the fibroids. I might even put in the title like plus update on my fibroid situation or something like that, just so that you guys know. Nonetheless, I love you guys so much. I hope that this was helpful. I hope that it rose the awareness that it so deserves. I hope that you guys feel seen, heard, and cared for by watching this episode. And I will see you guys in the next one. Bye, guys.